Hi, everybody, and welcome to my EA San Francisco Speaker Series talk. I'm going to talk today about COVID-19 because I'm sure that nobody has gotten sick of hearing more about it. But first, a little bit about me. I've been talking about pandemics for a while, a bunch longer than everybody else. Not everybody else. Um, and in the run up to everybody noticing COVID-19, I was talking about it and discussing it publicly and didn't do as good a job as I would have liked to. Given that I'm a super forecaster, I should probably have done a better job forecasting. And so I wrote a postmortem to talk about what I got wrong and what I got right and how that worked. I think that postmortems are kind of valuable generally. It's also a lot easier to call something a postmortem than it is to call it an apology. Um, you know, I think that it's easier for people to say, let's look at what goes wrong. And I think that it's a really valuable thing for people to do. So I definitely want to at least provide an example of how that works. So I can talk a bunch about what I did, and I'll go through that quickly. Um, but it took me a lot longer than it should have to realize how bad COVID was. I was skeptical that border closures would work, and I'm not entirely sure that some of the more strident advocates of border closures are being reasonable. But I was dismissive about masks um, early on meaning before uh, mid March, early April. I wasn't clear enough about telling people that this was going to be a big deal and that they should be preparing. I was more worried than I think I should have been about hospital-based transmission, and this is in past pandemics. This has been a really, really big deal. We've seen some events, especially recently, where hospital-based transmission was a very big deal, but it wasn't as big a deal as we worried at first. I was much too confident in the U.S. government, and on less wrong, I definitely did not do a good job keeping calm when I was telling people that um, attacking agencies for things that they didn't get wrong is not acceptable, even when I think that I was wrong about how good a job they had been doing. Now, I could spend a lot more time talking about all of these things, but I do have the less wrong post, and I'm happy for people to read that and hear more about this. I will say some of these things were just my fault doing things badly, but it's nice to be able to say, well, yeah, but predictions are hard, especially about the future, and lots of people got this wrong. I don't think that that fully excuses failure. And I think that it's valuable to still compare what you did to where you could have been. So I think that both as a way for me to excuse myself and as a way to compare, it's valuable to look at kind of what other people did. This looks a lot like the list of things that I got wrong. I think that there's a reason why, and it's because I'm kind of connected to a lot of this expert community. Um, and I definitely think, as I'll talk about a little bit later, that this was a key fact about why I got things wrong, was because I was over reliant on expert judgment. I want to say, I think the rationalist community, the EA community, got a lot of things right. This is really important. It was critical. I think that noticing that it was a problem quickly was a big deal. There were a lot of things that were really important that they just got completely right. I think that there were a couple of things that they were wrong about in ways that seemed obvious to me about what it is that they were doing to prevent transmission. the other side of that is a lot of things that seemed obvious to me in retrospect I was wrong about. So I think that they were the community was correct to think that most of the things that they were looking at were at least reasonable. I also think that effective altruism and the rationalist community have been very strong supporters of judgmental forecasting in the mold of Tetlock's super forecasters. I think that it's really valuable for lots of things, and I think that there are limits, and I'll talk about that a little bit later. I do think that a critical thing that was wrong with the community response was that there was much too little recognition that community response has impacts on broader society, and buying up lots of masks was in fact defecting. Masks were effective. I think that cloth masks should have been worn much earlier, and buying up N95 masks in fact made it harder for hospitals to get them, and people got sick and people died because of that. I think that this is we need to be clear that, especially as effective altruists, defection from doing good for the broader community shouldn't be something that we look at, even when we're right about noticing the problem. Okay, so the question is, should we have seen this coming? And I think that there's a really good case to be made that rare events are fundamentally hard to forecast. Even as they start, it's much less clear. It's very plausible in retrospect, if we got to run the world over a couple dozen times, that most of the time COVID-19 would have been contained in China. I'm not sure that that's true, but I think that it's very plausible. That was true in January. It might have been true in February. By late February, it should have been obvious that this was not what was happening, that the outbreak was in fact propagating, it was in fact spreading to other places, and we should have, the international health community should have pushed much harder to suppress the outbreak and do a lot of things differently. I'm not going to focus so much on the many things that went wrong, but I don't think it was obvious I don't think it should have been obvious to anyone that it was being mishandled as much as it was. There were people who claimed that it was being mishandled. I'm fairly confident that most of the people who claimed that it was being mishandled claim that government mishandles everything, even in places where they really don't. So I'm probably too far to one side on expecting experts and governments to be able to handle this, but the assumption that this would definitely be a big problem because governments definitely can't manage it, I think, is unreasonable, especially given that most novel diseases do get suppressed pretty quickly and pretty effectively. And if you look at SARS, if you look at Ebola repeatedly, they do in fact get controlled. But we weren't really clear about this, and maybe we can say that we couldn't have known. It'd be really convenient for me to say, look, this is fundamentally unknowable, and it could have been suppressed, it could have been stopped, it would have been fine. The fact that we failed was somewhat predictable, and the question is, how predictable was it? So if you were to have asked me a year ago what the probability was that there'd be a pandemic that kills more than 1% of the global population, I think I would have said something around, in this year. I probably would have said something around 0.5%, because I think that there are a lot of reasons that these types of events are very rare. COVID might not get that far. It seems very, very plausible that it won't get quite that bad. It's unclear, but I don't think that the probability was off by more than an order of magnitude. I think that uh, anybody who says that it was obvious that this was going to happen, that this will happen every decade, is confused about what will happen. But it's a rare event, so it's hard to predict. I think a good example of this is if you ask whether it's going to rain out in San Francisco tomorrow, and the answer is no. How confident are we? Well, it never rains in July. Um, this just isn't a thing that you should worry about. Can you check? Can you figure it out? Well, if you go outside and you see that it's raining, then you should probably change your mind. But checking weather forecasts can probably tell you a little bit more that, like, oh no, it's not going to rain. But the value of checking weather forecasts in San Francisco in July is really low because it's not going to tell you very much. So that's fine. But what about if you're planning an event for a Sunday in October, the 11th, and you want to know if it's going to rain, and you have a prior estimate because you know climatologically that 10% seems like a reasonable number for the percentage of the time that it rains, but you want to know a little bit better than that. So what do you do? And the answer is you can't check weather forecasts. They don't work that far in advance. There's no source of information that's going to tell you much more than that base rate. In December for COVID, I don't think that you could have done much better than the base rate. In January, you probably should have been updating pretty strongly. By February, you should certainly have been able to guess that this was going to be a big deal. And the fact that news organizations and governments still weren't treating it seriously in mid-March and April, and some still aren't now, is not inexplicable, but certainly inexcusable. When you go outside and it is in fact pouring, that should be enough evidence for even the dumbest person to know that it's raining. So I think that the question then is, why was I wrong? What did I get wrong? How do you improve? And as I said before, I got things wrong in a lot of the same ways that experts did. I relied on them, I think, too much. I think I should have been more fox-like in my thinking, as super forecasters should be. I also over-relied on super forecasters who were asked specifically about this, and I was not paying attention to this. I was busy with other things, and I missed the fact that super forecasters were poorly calibrated until early March mid-March when I started forecasting and said, wow, people are assigning almost no probability to this getting out of control, and that seems crazy. And by April, I was significantly more pessimistic than almost all of the super forecasters, but it took me a while. I was too reliant on super forecasters to have correctly updated. And I think one of the reasons that happened was because the types of things that you need to pay attention to notice events that are rare are different than the types of things you pay attention to notice events that people typically pay more attention to. And I don't think that people were ready to look for those sorts of information and think about them. The other issue is cache thoughts, and I think that this is critical. I didn't re-examine my assumptions about how well or poorly the government in the US and the World Health Organization and the UK would do. The government was far less competent than it had been, any time in recent history. I think that I was over reliant on CDC because I know people who had been there, and I had talked to people at CDC back in 2017 when I started looking into global catastrophic risk during the Obama administration, and they had planned for this, and I was not reconsidering my assumption that this was um, still within their capability. I'm still somewhat confused about how very poorly it was managed. Um, how did I do better? So I think that looking at less wrong, definitely, and looking at effective altruists and looking at people who were thinking about this definitely pushed me to reconsider much faster than most of the world, which is claiming very little credit for myself. But I think that at the very least, looking at a diverse set of inputs is critical. I think that being Fox-like beyond just looking at different expert models is really valuable. And when you start feeling raindrops, you should not tell everybody that really this is just the flu. Okay, so how much better can we do? Because I think that this is critical if we're interested in forecasting, and I think that for a variety of reasons, effective altruism needs to be very, very concerned about the ability to forecast the future, both for global catastrophic and existential risks in bio and in AI. And also because if you care about the long-term future generally, we don't have a very good way to predict what's going to be happening in 1,000 years with any kind of clear bounds on how accurate or how reasonable our estimates are. So I want to talk a little bit about theory of probability here. Aleatory uncertainty comes from the word alea in, I believe, Greek, which means dice. Dice are completely unpredictable, at least in the kind of ancient mode where you took a die and you rolled it and you had no idea other than the base rate about how likely it is to land on each side. So you spin a roulette wheel and there are 36 numbers plus 0 and double 0, and you can figure out how likely it is that it'll land on the first 12 numbers. So great, we have the answer, right? Well, I'll point out, and you may have seen this particular episode of Mission Impossible, in which case you might know the answer, but the dealer calls no more bets after the wheel begins spinning. So there's more information that maybe you can do something with, and the question is, can you? Because if you can do better than the base rate, you might be able to win money from the casino. This is a bad idea. Do not try and cheat in casinos. The money you will make does not compensate for the fact that they have security. We can do better than 50% with a video of the first few seconds. They've done this. You can train a machine learning model based on the video. You can do really well just based on that, which makes you wonder, how much better can you get? Because if thinking enough and enough reflection allows you to do much better than the base rate, maybe that's a general thing that we should be trying to do. And the answer is complicated, and I don't think we have great answers, but John Wentworth commented on my less wrong post with the postmortem that to outperform base rates, you have to do an expensive update. Somebody has to build a machine learning model to watch the roulette wheel and predict what's going to happen. That's not cheap. You have to pay the money. Somebody somewhere has to do this. There's a limited amount of benefit you can get from asking other people to do the updates, from asking other people to look at it, because the easy things to update on are already reflected in, if not base rates, at least generally understood rates. But once somebody has done the update, once somebody has built the machine learning model, other people can use it if they're willing to share. I think that one of the benefits of super forecasting and similar approaches is that it does a good job letting people aggregate information that enables everybody to update. But the cost of doing this and how much uncertainty you can reduce is really, really uncertain. What information should you have been looking at to notice COVID-19 in, um, let's say, late November when the first cases had shown up? And the answer is probably there's no way to have noticed that other than actually having people monitoring the number of pneumonia cases showing up in hospitals in China and doing tons of data analysis. By mid-December, you probably could have noticed something going on if you paid a lot of attention to, let's say, somebody tried to do a study. I don't think it's very reliable, but if you did it well, looking at the number of cars parked at hospitals in Wuhan might have told you something. You might have been able to do a little bit better than basic. It's a very expensive thing to do in general to try and monitor data sources like that. Maybe you could do a little bit better, but the cost of doing that generally when you don't have any reason to think that you're departing from base rate already, I don't think it's worth it. I don't think you could have done better. In mid-January, in early February, I think that on some level it's inexcusable that the world didn't notice this better, that I didn't notice this better, that other people didn't. Okay. So value of information depends on a bunch of things. So what it is that you care about, whether is it worth watching hospitals in China from now on, watching hospitals everywhere? Should we should the effective altruism community should somebody apply for a grant from OpenPhil to start a project where they do image classification of satellite images of number of cars parked in front of hospitals in every major city in the world? No, that's a really low value of information project because it doesn't give you very much information. It's not going to change your decision. Um, it's just not enough information. Well, if we had gotten really good information about this, what would we have done differently? For a pandemic, maybe we could have convinced people to close borders earlier if we had been much clearer. As I said in January, politically it's not feasible. You need to have enough evidence that things are going to be bad to already know that they're going to go bad. So I think that this is kind of a fundamental limit, that value of information limits how much it's worth trying to buy down uncertainty. And I think that we need to think really clearly about this because it is hard and it's critical for a lot of questions that we care about in terms of what decisions we should be making, both as effective altruists trying to affect society and as society trying to prevent disasters. And if you're looking at the long-term future, it's just fundamentally really hard. So in summary, yeah, I screwed up. Admitting error is not just kind of emotionally costly, but like also reputationally right now, it's very clear that politicians and experts should not be doing postmortems if they want to get reelected or keep their jobs. This is a bad thing. We should promote the norm of admitting errors, even though it is still costly. And so I think that that's my first big claim. Generally, postmortems are valuable. People should do them more often. Publicly, they should post their results. They should explain how and why they did things badly and what it is that could be done better in the future. I think that there are some substantive questions about how it is that you understand expert opinions and forecasters and outside experts and risks. These are difficult questions. I'd be really happy to talk about them more. I have a couple of papers I'm thinking about writing about kind of the fundamental cost trade-off for getting closer to the aleatory baseline for predictions. But the answers here really matter for long-termism, and I think that that's something that we should be paying attention to. I'd be really happy to take everybody's questions. I think we're supposed to switch to the switch to the Q&A now. Thank you.